Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidder Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is part 5, Prediabetes. I hope you enjoy it. These talks are part of our efforts on health promotion, focusing on diabetes prevention and early detection, so you can become a healthier version of your previous self. As mentioned before, we have these two health enhancement and weight management programs, ARIS, which is a startup program destined for younger, overweight people that they just need a little bit of help to start a cycle of better lifestyle choices and better diet. While Janus is a more comprehensive, structured and complete program, therefore more impactful, destined to middle-aged or older groups, people that most likely can have other risk factors for metabolic syndrome or have metabolic syndrome already, or prediabetes or diabetes already and want to prevent all the complications. Or maybe for people that have tried other methods and they have not succeed, or they have leave it for later for the next New Year resolution, but that doesn't occur. So we believe we can empower patients to eventually be able to take care of themselves after leaving the program with better diet and lifestyle choices. So please call this number if you are interested in enrolling in any of these programs. Let's start with our talk properly. It is, what is prediabetes? It is a stage before developing frank type 2 diabetes, where the beta cells of the pancreas, the ones that produce insulin, start getting fatigued and overwhelmed by high blood sugar levels, and also insulin resistance start building up. It is very common. In many patients it's silent. Other patients have some symptoms of high sugar, like feeling very thirsty, going frequent to urinate. But despite can be silent in many patients, it is detectable. It associates with obesity and metabolic syndrome. So that's why through ARIS and Janus, we want to tackle it at the early stage of prediabetes, or even at the overweight or obesity stage before it moves into prediabetes or even diabetes. Because if no action is taken, the path for diabetes is put in red carpet. And importantly, prediabetes also gives the patient heart risk as diabetes does. So it's not really a benign situation. It can be diagnosed by blood tests, the similar blood tests that you do for diabetes, but the ranges are not normal, but not as bad as diabetes. You can measure the fasting sugar, the response to the liquid sugar I mentioned before after 2 hours. You can also measure the levels of the glycosylated or caramelized hemoglobin I mentioned before. And what are the risk factors associated with prediabetes? There are multiple. Older age, female sex, certain ethnic groups, for example in our setting, Singaporeans, Asians acquiring a Western diet and becoming overweight or obese. Mexican, Hispanics are very prone. Higher load of sugar, fasting glucose, overweight, the presence of polycystic ovary syndrome, higher blood pressure, high cholesterol, high triglycerides, sedentary life, genetic predisposition, history of gestational diabetes, stress and sleeping problems. Many of them you cannot do anything, like age, sex, ethnicity, genetic predisposition. but many of them you can tackle them. You can improve your diet and minimize your sugar load. You can lose weight, improve your blood pressure, your lipid profile, become more active, try to minimize your stress, and go for early detection. But why so important? Why prediabetes is so important? Already mentioned that associates with heart risks, but it is the step before diabetes. And diabetes is like a spear in your health and whatever associates with it, your life, your dreams. And it's very common. These are statistics from USA. 1 in 3 Americans have prediabetes, and 9 out of 10, they don't know they have it, so they cannot do anything about it. And doing exercise, having a better diet, losing weight is very impactful. Can even revert prediabetes or prevent the progress into frank diabetes. So it is reversible and it is preventable. That's why Aries and Janus play an important role. We want to tackle prediabetes. We want to tackle diabetes. We want to minimize complications of diabetes. But we want to do it even earlier than that, at the overweight, at the obesity stage, before this has set. So it's therefore going to be more impactful. So that's why we're promoting this stuff, we're promoting these programs, because we know we'll have a lot of impact in your life, in your family's life, in the community life, and hopefully in the world. So you can move away of this path. You need to move away from this path. If you're in the trending state, you can avoid becoming pre-diabetic and therefore diabetic. But you need to put some effort for that. If you are pre-diabetic, you need to avoid to become diabetic. And if you are diabetic, you need to avoid complications. So you need to do some changes. You need to start running towards your health, not in the other direction. You need to start losing weight, doing exercise, having a healthier diet, and maybe give up some bad habits like smoking. But I trust you can do it. And I trust we can help you. That's why we have these 2 programs. That's why we ask you to kindly, please help us, subscribe to our YouTube channel, share these videos. Maybe you don't have risk factors, maybe you are not overweight, maybe you are totally okay, but maybe a relative, maybe a friend could benefit from reading these videos, or joining our programs, or joining any other program, because there are many that can be also effective. But we believe that we can help many patients or individuals with overweight, with obesity, with prediabetes or diabetes, to become a healthier version of themselves. So please call this number to enroll. So the next talk will be part 6, that is complications of diabetes. Thank you, take care, bye bye.